Hello everyone, my team and I will be presenting our project that is focused on developing a secure network and foundation for urgent care clinic. Our project is one with a practical application, whereby we have applied many concepts that we have learned throughout our graduate program. This project in particular has applied many project management and information security concepts. With that being said, let us move on to the next slide. Before we get to the good stuff in our presentation, let me introduce to you the team. In the first picture, we have Thomas Andersen, followed by Nikola Uskokovic, Keerthy Bharathan, and myself, Naomi, Chee. The four of us are grad students in the MS in Business Analytics and Information Security program. Now, to give you a rundown about what we will discuss in this presentation, let me pass the presentation over to Thomas.
Topics covered is going to be project overview, project goal, network and information security, and security controls for the EMR regarding HIPAA compliance. Project overview. To begin this presentation, we will begin by discussing the project and the goal we aim to accomplish. In the state of Hawaii, many residents suffer adverse health outcomes due to the lack of availability of healthcare personnel. Currently on the island, there are not enough staff or healthcare professionals to meet the Hawaii state of demand. In 2022, the state of Hawaii needed more than 3,800 healthcare professionals to meet this demand, which was a 76% increase in comparison to 2019. This is according to the Healthcare Association of Hawaii's report released in 2022. In addition, access to healthcare is difficult, as pathways are often complicated and costly. To prevent this problem from developing further, Integrated Care LLC, the Urgent Care Clinic, aims to provide accessible routine, preventative screenings, appropriate follow-up visits, and patient education by allowing Hawaiian residents to make a video call or an appointment in person with a doctor, telehealth, or manage their health easily and comfortably. Project purpose. The project purpose is to develop a basic network infrastructure for the urgent care clinic at the park on Keeaumoku. By having a basic network infrastructure, the clinic will be able to provide operational daily service to its customers, but it will also support and facilitate the privacy for its patients that they are seeing both telehealth or mobile.
Network and information security. The main objective of this project is to develop a proposal for the basic network infrastructure that could be implemented by the urgent care clinic. The network and information security phase consisted of 4 sections. The first was the information security assessment, where the team conducted a thorough assessment of the clinic's information security needs and developed a comprehensive security plan that includes both policies and procedures to protect the clinic's data. In the network design concept section, the team decided to use a wireless network for the clinic. The network will be segmented into different zones based on security needs. In the third section, network hardware acquisition, the team determined the appropriate hardware necessary for the clinic to conduct its operations. The team identified 6 essential hardware components such as firewall or router, switch, access points, laptops, tablets, and printers. All of these devices mentioned play an important role in the operations of the clinic, while also creating a secure and reliable network. Finally, the fourth section is information security controls. Considering the budget of a small business, the team has considered different options for firewall setting, intrusion detection and prevention systems, antivirus software, and data encryption. For firewall, a cost-effective solution would be to consider using an open-source firewall like pfSense or OpenSense. The team recommends using Snort or Suricata as viable options for intrusion detection and intrusion prevention systems. For antivirus software, the option that the team considered was a free solution like Avast or AVG. Finally, the last security control is data encryption. The option that the team has considered is VeraCrypt, which is a free open source software that allows users to encrypt data. Additionally, transfer protocols such as SFTP or HTTPS can be applied to encrypt data in transit.
Based on the information provided, it is noticeable that the team focused a lot of its energy on security controls for the network. The main reason in doing so is to protect client information at all costs. Today, many medical service providers use EMRs as part of their daily operations. Because the urgent care clinic we are working with will be providing medical services to the community, the team took into consideration HIPAA compliance, regulatory research, and concepts. As many of you may be aware, HIPAA sets the standards for protecting sensitive data in the healthcare organizations. To stay HIPAA compliant, integrated care must follow certain best practices. Firstly, it is essential to conduct regular risk assessments to identify potential vulnerabilities and threats to patient information. Integrated care should implement administrative, physical, and technical safeguards to secure electronically protected health information. This includes limited access to authorized personnel, using encryption to protect data in transit at rest, and ensuring that the system's software are up to date with security patches. Secondly, it is crucial to train all staff members on HIPAA regulations and security controls. This training should cover topics such as password hygiene, recognizing phishing scams, and proper data disposal procedures. Finally, it is essential to maintain comprehensive documentation of all security policies and procedures, including risk assessments, training records, and incident response plans. HIPAA mandates that covered entities have written policies and procedures in place to protect patient information.
You have made it to the end of our presentation. Mahalo for listening. We hope that you have enjoyed the presentation and that you have learned how our team is implementing theoretical concepts in the medical industry. If you have any questions, join us this Friday during session 1B. See you then.